Very true. So I thank you, Dr. Chandak, Dr. Ashok, and all the organizers to give me this opportunity. Basically, I'm interested in computer. Everybody knows that since 1919, I have prepared or developed my software, which is called Medicase, which so many other colleagues are using. And there are many other medical software which I have developed with the coding. And I have conducted professionally some scientific meeting, which is fully computerized. And now I'm associated with the healthcare ERP solution, which is developed by a company called Corporate Muni. So with that background, let me tell you something about the operation theater management system. So challenges are like everybody wants to remain in a competitiveness and to improve their performance constantly. And so for that, they have to adapt management system to ensure survival. They need tools to ensure that all resources are efficiently and fully used. And for an economic manager, it is very important to optimize the OT. That is their first concern. But the problem is it is too complex to manage. Now that was the image, but it is not true nowadays. So what is the scope of this software? The scope of this software is what all the speakers have talked about and what other speakers are going to talk about. Everything can be incorporated into the software, including the light, the ergonomics, and the Kanban card, and whatever you want can be included into this particular software. So what software can do? It can do operation scheduling, patients monitoring checklist, which is very important. As you know that all airlines, they go very smoothly because there is always checklist, and checklist. Comprehensive preoperative assessment, multilingual consent forms, stock and inventory, which is a very big headache. Sterilization schedules, audits, checks, and everything will be there with the code, and that with you can just scan it and you know that at what time it was autoclave. Anesthesia details, recordings, and interface with the monitoring devices. Now the new softwares can interact with your old latest tools, and they will tell you, as he was telling that there is a car. So once you put it there, that for that particular surgeons, the speed and everything of that particular machine can be adjusted. And with that interactions with the latest equipments, this software can give you abnormal reading alerts, and it can tell you that something is going wrong. More than that, the advantages are that it improves the planning and utilization of the OT, reduces inventory, and helps you purchase planning equipment, because earlier you have purchased so many instruments which is now not required, and you know what has happened with them. Ensures OT equipment's inventory, specifically the preventive maintenance, which was for the light, proper utilization, and annual maintenance contract. Keep tracks of expensive consumable, which is very important. Quick access to the previous surgery reports where the surgeons wants to know something about that, and it improves the patient safety, experience, and satisfactions. More than that, it links surgery with the staff scheduling and track their movement. You know that who is an IITV technician, so you know how many today have come through your, the finger, the biometrics, and you know who are available. So how can you manage those things? Actively based costing of OT is also possible with that. Real-time air quality, temperature, humidity, everything can be controlled by the software, ensuring constant temperature of the life-saving drugs, which is very important, and critical alerts on movements and usage of the equipment. More than that, aligning equipment usage to patient's billing. So directly it goes to that. You have not need to go on finding out from the case paper. Staff roles responsibility for improved maintenance and availability. You know that this is the operation which is very complex one. So whom to allot this particular case? Part of the hospital portal it becomes. So when it's integrated as a whole, you can access all information to smartphone and tablet devices, and you stop talking so much that why the patient is postponed, what is going to be taken next patient, and all these things are available on your small device. There can be a provisional and final scheduling of the operative procedures, configure anesthesia services, map anesthetics, pre-operative checkup and pre-anesthetics checkup, and all those records for pre, intra, and post-operative records managements with a post-surgery recovery and patient transfers. And also it improves in the easy ordering of the procedures. You know what is going to happen tomorrow, and the whole preparation of the patients and who has done shaving and what has happened and is it the patient ready for that. or auto updation of the patient status. Very important is that all WHO safe surgery checklists can be incorporated into the software. So you know very well that you are doing with all checklists, blood transfusions and implant management. You do not know what has been put as a sterilization, but with your mobile, you can find out yesterday, all these sets have already been ordered and it is mobile. We know very well the instruments and the counting of the swab that can easily be controlled by this software. And once it is integrated with the autoclaving machines and the operations, it ensures discipline and separately norms because you are not opening to open up any, the pocket which is not sterile. You can have a fully coded surgical procedures, duration, you can standardize with the reminders and you can minimize the cancellations. You can have an administrative workflow which is attached with the administration, billing and systems, and you can improve the coordination between the theaters and the inpatient wards, because sometimes they care, you do not know whether the cots are available or not. That can automatically be integrated into this software. And very important thing is that when you have multiple operation theaters, there can be a big board view to keep track of patients' location, movements, and what is going on inside the theater. So when it comes to the management of the inventory, we know this is a common look at the mid-size or the small-size hospitals. And for that, which is very much important, is to understand such softwares and to involve fully to make the masters, which is called item groups, and something like routine equipments like tables, lights, cautery, trolleys, IITs, etc. Right from their procurement to their condemnation or lost, everything is tracked into that software. Special equipments like microscope, drill, navigation system, and all those accessories, including that, routine and special instruments and SAT, all can be inside this software. So every Sunday, when you want to count it or when you want to make them again fresh, all these things can be done with the software. Very important is the consumable. The software makes a track of that in a common procedure, how many blades are used, how many gloves are used. So that can be very much tracked. And also the cleaning part of the OT, how much of the antiseptics are to be used. And more importantly for this inventory, linens, kits, and OT dresses. So you know how many are in use, how many are in the stocks, and you will have no problem, especially in the case of a monsoon season where you're not able to get all these things. Most importantly is the emergency medicine, the crash card. With this software, there will be multiple alerts that these are the medicines which are very essential, which are already with an expiry date. So please replace. These are the some of the screenshots of such softwares where you can see with the equipment masters where all the details of the name of the equipment, code, category, serial number, group, location, party name, purchase, warranty, the start of AMC, end of the AMC, purchase amount, the type of AMC branch, everything is there. So you will be able to have a very smooth way of finding out whether the instruments are working well with that. Now, the problem is of how to select the software. Friends, it is very important to understand that there are two terminologies. One is called application and another is called solution. We need solution because the solution has zero customization. It is a granted implementation. It is a zero vendor dependency. Every time you are not to go to the vendor and tell that you make these changes, because it is a customizable solution which you are purchasing, configurable basis, configurable workflow, configurable analytics which is there, and select a company who has got a comprehensive training and handover system with a yearly technology and product updates. Now that is very important when you select the software. The problematic which is occurred, which is very well published in this article, is that there is a logical approach to planning with a deterministics and stochastic data. Both are different. As you said that the last moment something goes wrong and you find that there are the problem. Something like unforeseen but very frequent events could make planning unnecessary during the implementation phase. Don't worry. All these things can be taken care of with the latest software. So frequent need of new paradigm control and management techniques also can be included in that. It is not something which vendor has given, so you have to teach to that paradigm. You can change the paradigm also. It requires some automation to establish an initial calendar optimized with the static data and to have an automatic maintenance in near real time according to the dynamic data by means of a multi-agent system. So what is multi-agent system? Now I'm going to confuse you all, because multi-agent system is surgeons to plan, admin agent, Then there is a surgeon agent, there is an emergency agent, there is an expert agent. What is this all about? There is a room agent, and all these things are incorporated into that. So what is happening with us? We are not taking interest into that, and somebody is preparing that. Also, they are coming out with the hybrid architecture where there is a predictive hierarchical control, and also there is a cooperative real-time control. And you won't be able to understand the right side figure because we feel like that we are not interested in that, but we need to take interest. Once you take interest, when it becomes an artificial based execution, which is already going on, you will be able to contribute a lot, and the things will be more and more. As Dr. Chandak said, that there are few innovations you can make and things can go smoothly. Much in the same way, you have to take interest in the software and you have to contribute and you have to find out. So why all these things are happening? This particular publication says that it is both because of the artificial intelligence. So you to know what is AI, understand it in orthopedics. As a doctor, you need to learn, make no mistake, because a new textbook is coming up. If you do not understand, they will, throw everything on you, and you have to go according to that new textbook, which is with the artificial intelligence. Why? Because the third leading cause of death is a medical error. And medical error can only be minimized if you take the humans out. You do everything with an artificial intelligence. So up to $1.2 billion worth softwares are now developed for healthcare industry, because healthcare industry is as dangerous as airline. There can be death if there is an error. So now what sorry, somebody is okay. Now what I want to say, what stalwarts are talking about AI. So think of artificial intelligence when you incorporate in your whole management, including operation theater. It is an efficient and autonomous, because
Facebook, Apple, Microsoft are all moving ahead at a great speed in improving this artificial intelligence software. So it's very exciting. Software is going to solve that, where it'll look at all the new information and present to you, knowing about your interests, what would be most valuable. So making us more efficient.
We're focusing on what we've talked about on autonomous systems. And we sort of see it as the mother of all AI projects. So autonomy is something that's incredibly exciting for us. We'll see where it takes.
Now, regarding the robot and no error things, you want something where there should not be error.
It'd be wonderful if someday we got to the point where there were robots every place. They were running farms, they were running Apple, they were running Berkshire Hathaway, and all you had to do was one person could punch a button at the start of every morning, and all the goods and services that we're getting now would be turned out by robots.
It is seeping into our lives in all sorts of ways.
It is seeping into our lives.
We're just getting better and better at it, and we're seeing that happen in every aspect of our lives, from medicine to transportation to how electricity is distributed. And it promises to create a vastly more productive and efficient economy. And if properly harnessed, can generate enormous prosperity for people, opportunity for people, can cure diseases.
This is very important to listen, because what is happening, we are unaware of it.
Because it eliminates inherent human error in a lot of work.
So to eliminate error, it is very important, and there is no constraint on this.
AI is probably the most important thing.
So Sundar says there is no constraint, and do not worry, because Amazon person says
idea
that
there's going to be a
it's not going to kill
AI
us.
overlord that subjugates us or kills us all.
So that is not going to happen. So what is important, listen to me very carefully. We know that we have an image that software cannot do everything, but it is able to do because of this particular terminology, which is called fuzzy logic. Now, computer knows, like in real world, we cannot say yes or no because it depends on multiple factors. So now computer knows what do you mean by any symptoms, which is never, rarely, sometimes, often, most often, and always. So it is not earlier like it is only yes or no. So all these logics, it may be any number of alterations, but it knows. On this background, What we need is to take full interest in AI. We should not left it with the engineers only, and also the patient has to take active part into this. So friends, if you are not careful using this software, Google, IBP, Microsoft will take over your Sterling, Justlocks and AIMS hospitals. So be very careful, wake up. And at the end, let me tell you, my message is that avoid jugaad, use software. It's a choiceless happening, which is happening, and you need to adapt as early as possible, involve fully and sincerely, and contribute for a future. Do not sleep now. A sea change is happening with IT and AI, so use that. And at the end, there would be a blockchain technology which will bring Satyu to healthcare. Everything will be truthful. So thank you very much for giving me this opportunity to talk about